My name is Dr. Monica Betancourt Garcia. I'm the Scientific Director for Trauma Research at DHR Health and also the Director of the Junior Clinical Research Internship program.
Well, Monica, thank you so much for giving us an interview today. Tell us what's happening with this program.
This is the third annual Junior Clinical Research Internship. It's a program where we invite high school students to come and learn about different healthcare professions and to get hands-on skills and learn about healthcare professions.
Where are the students coming from?
The students are coming from all over Texas. So they originally started just the Rio Grande Valley, but we've expanded to include other districts around Texas and also members of the community.
Yeah, that's news to me because I remember coming here last year and it seemed to be the Valley students, but now all across Texas.
Yes, so we originally partnered with Region 1 to make this a reality for the students of the Rio Grande Valley, and we were really grateful for that partnership with Region 1. But now we've also included other districts as well from the community and from other parts of Texas.
That's quite a logistical challenge, isn't it? Because we're at one end of Texas.
Sure.
People have got to come across the state to come down here.
Absolutely.
They must really get something out of it to make this that travel.
Yeah, I think that the students are really become lifelong learners when they're here, right? They have some difficulty maybe in their classes for different reasons, but when they come here, I think the innate belief that they can do it, right? The confidence that they get when they leave here really transforms the student. So, we're really excited to bring this to members of the community. We have some students even coming from Washington, D.C., from other parts of the country that are actually coming to participate in the research internship program.
How many students in total?
So this year we have 250 students. We started with just 12 students, 13 students back in 2001. So we've really grown, and we hope to continue to grow if we can.
And how long are the students here for, these different cohorts? How many weeks of training do they get?
Sure, so they're here for 2 full weeks. They're here Monday through Friday from 10 a.m. to 4 p.m. And so throughout that time, they do get some didactics and they understand kind of, what research is all about, what is medicine all about. But they also get a lot of hands-on activities and a lot of tours around the hospital to kind of really feel what it's like to be in the environment.
And I guess they get they sample all manner of the different programs you have to offer, the different specialties there are here at the hospital.
Absolutely.
Not one particular subject.
Absolutely. It's not just about medicine, although we think medicine is very, very important. There are many, many services and many different professions that come and bring a hospital like this together. And so we want them to understand what radiology is about, what phlebotomy is about, what nursing is about, all the ancillary services that come together to kind of make this reality. So we like to bring all of the professions and kind of present them to the students so that they can pick what they like.
And when you gather the feedback afterwards and you talk to the students, like you said a moment ago, for some of them a life-changing experience. They come down here, they sample what working in the healthcare arena is all about, and they say, that's my chosen career.
Yeah, absolutely. They're so excited when they leave here. They get some experiences that they would never be able to get anywhere else. And so again, the confidence, the networking, the understanding that we're here for them even when they leave. If they need college applications they need help with college applications, we're happy to help them do that. If they need letters of recommendation, we're also happy to help them do that. Internships, observerships, anything we can do to help them advance as a student and again as a person, we're happy to do that for them. So they're really, really excited to get this experience.
I know you said earlier it started some years ago, 2001?
2001, yes.
2001. So is there anyone in particular that you feel should get a shout out that was a pioneer that helped start this all those years ago?
Absolutely. So when we first started, it was myself and Dr. Rao, who was our former president and CEO of the Research Institute, that came together to kind of bring this a reality. And so we're really, really grateful. Our partners with Region 1 were also really instrumental to bring that first program to the Valley. And so Dr. Elisa Alvarado headed the PATHS program to bring that together. And so through those partnerships and through those collaborations, we were able to expand it to now, again, to different parts of Texas and as well as nationally.
I remember last year interviewing Dr. Singh, the CEO here at the health system, and although we think the students are getting something out of it, he was telling me how for him this was like his favorite event of the year. It was so moving to see, like you say, how the students, it is a life-changing experience for them, and they learn so much, but he was just blown away.
Yeah, the
Did
students.
you hear about that?
Absolutely, the students are so excited, and you know, our team is really, really proud of the work that we're doing to be able to bring this to the community. We help patients every day, but to kind of inspire young students to kind of come into this environment and be able to contribute to the community in that way is really, really an amazing experience. Also for their parents, right? Their parents are really, really grateful that they get to come here and learn about new things, and then have a different, you know, son or daughter when they get home, right? They're just more responsive, and they're more responsible, and they're just kind of happy to kind of move forward. And so that's something that we're really looking forward to.
Have you heard of anything like this in other health systems around the country, around the state, or is this something special happening here?
Well, we try to create a really unique program. I'm sure that there are other programs out there in the country that kind of model something similar to this, but we have a really large research underpinning, and so it's really important to us to kind of look at that scientific role. There's no other program that I know of in the country that allows them to publish a manuscript by the time that they're finished, and so this is just a wonderful opportunity for the students to kind of get ahead, to make themselves look different than any other student in the country when they're participating here.
Well, it seems as though you've thought of everything. I mean, you've had experience every year and you've refined the program, but there's all sorts of things happening here during these weeks.
Yeah, absolutely. So they not only get, again, didactic courses, we have different surgeons, nurses, different members of healthcare professions come and speak to the students and give them lectures. They also have to write a publication. They have to write a research manuscript. So that comes up with a lot of work and a lot of learning on their part. And then they have numerous hands-on activities. They get to do blood draw, they get to look at radiology, they get to look at urology. And so there's many different aspects. There's many different aspects to the program, and then they also get tours in the hospital. So not only do they get to see it and do it hands-on, now they get to look at the professions in their environment, looking at how it's done in the hospital.
And so the ages of the students, how many years away are they from starting their career?
So the students are all high school students. The majority of them are seniors this coming school year, but we do have some that are 10th grade and 11th grade. So they're really close to getting their college applications in, and really close to kind of, you know, looking at the future and looking at what they want to do in the future.
And when they go down this path and they say, yes, this is for me, do you want to hear from them in the future for potential job openings?
Absolutely. We would love to have them part of the DHR Health family. That is always one of our goals, to make sure that they're welcome here, to make sure that they have the resources necessary for them to succeed. Absolutely.
Do you happen to know if the state leadership up in Austin, do they know about this? I mean, are you getting plaudits from you know, the legislature, the people that, you know, give contributions financially? The legislature would help different health systems. Do they know what a success story you've got?
I don't think so. I think that you know, we touch out to the media, and we try to, you know, publicize as much as possible within our community, but I don't know if it's reached Austin all the way.
Dr. Betancourt Garcia, is there anything else that you'd like to add?
We're just really proud of the program. We're really proud of the students. For them to give up some summertime, their vacation, to come and learn, I think really says a lot about the students in the community. I think they're hungry for it. I think that they're willing to work. And you know, we're just happy to provide the service and really happy to contribute to the community in this way.
Well, Dr. Betancourt Garcia, thank you so much for today's interview. We've learned a lot. Appreciate it.
Yes, thank you so much. I appreciate it.